Hello, my name is Dr. Adam Farber, and I would like to talk to you today about some of the most common sports injuries that I see in my practice. The 5 most common injuries that I see in my sports medicine practice are ankle sprains, muscle strains, tennis elbow, meniscus tears, and anterior cruciate ligament injuries. Let us first talk about ankle sprains. The ankle joint is composed of 2 bones of the lower leg called the tibia and fibula that form the top of the ankle joint. These 2 bones articulate with the talus at the ankle joint. The ankle joint is stabilized by ligaments both on the inside or medial part of the ankle, as well as the outside or lateral part of the ankle. An ankle sprain occurs when these ligaments are stretched, partially torn, or completely torn. This most commonly occurs with an inversion type injury in which a patient reports rolling their ankle, as shown in the figure on the left, but ankle sprains may also occur with eversion type injuries, as shown in the figure on the right. Patients who experience an ankle sprain report significant pain at the time of injury and may report hearing or feeling a pop. The vast majority of ankle sprains affect the ligaments on the outer or lateral part of the ankle. Swelling, bruising as shown in this picture, and stiffness may occur after the injury. Most ankle sprains can be treated successfully non-operatively with rest, ice, anti-inflammatory medications, protected weight bearing with the use of a splint, a boot as shown in the image on the right, a brace, and/or crutches as needed. A muscle strain is another commonly seen injury in athletic patients. Muscle strains, also known as pulled muscles, occur when the muscle is overstretched during physical activity. This can lead to tearing of the muscle fibers. Patients typically report a sudden tearing pain in the affected muscle and may or may not report hearing or feeling a pop. Pain, swelling, and bruising in the affected muscle, as shown in this picture, frequently occur after the injury. The most commonly affected muscles include the muscles in the front of the thigh known as the quadriceps, the hamstring muscles in the back of the thigh, or the calf muscles in the lower leg. Muscle strains are treated conservatively with a combination of rest, ice, anti-inflammatory medications, and stretching and strengthening exercises after the initial pain subsides. Tennis elbow is a common source of elbow pain in an athletic population. Tennis elbow, also known as lateral epicondylitis, refers to a condition in which there is degeneration in the tendons of the outside or lateral aspect of the forearm muscles. Tennis elbow typically does not occur from a single acute traumatic injury, but rather as a result of overuse. Tennis elbow is most commonly seen in tennis players, but it may be seen in any athletes who engage in repetitive gripping activities such as golf, baseball, softball, or weightlifting. Tennis elbow causes pain on the outside aspect of the elbow that is worse with repetitive use, lifting, or gripping activities. Most patients with tennis elbow are successfully treated non-operatively with a combination of rest, ice, anti-inflammatory medications, the use of a tennis elbow strap, stretching and strengthening exercises, and occasionally steroid injections into the painful area. Rarely, surgery is required to treat symptoms of tennis elbow that fail to respond to other treatment measures. Another common injury seen in athletes in my practice is a meniscus tear affecting the knee. The meniscus is a soft tissue cartilage pad that acts as a shock absorber between the thigh bone and the shin bone of the knee. There is one meniscus on the inside part of the knee called the medial meniscus, and another meniscus on the outside part of the knee called the lateral meniscus. Each meniscus is shaped like the letter C. Sudden twisting or pivoting activities can lead to tearing of the meniscus. Meniscus tears can also occur in older athletes, as this structure tends to degenerate over time and thus become more susceptible to tearing. Patients who tear the meniscus often report hearing or feeling a pop at the time of injury. They typically report pain on either the inside or outside part of the knee. The pain tends to be worse with weight-bearing activities and may be associated with swelling. Patients may also complain of locking, catching, or painful popping in the knee. There may also be a decrease in the ability to flex or bend the knee. Unlike the other conditions mentioned above, patients who sustain meniscus tears of the knee typically require arthroscopic surgery to either clean out or repair the torn meniscus. The ACL, or anterior cruciate ligament, shown here in the red circle, is one of the 4 main ligaments that help stabilize the knee during sporting activities that involve twisting or pivoting. Tears affecting the ACL are the most common knee ligament injury seen in my practice. Contact injuries of the knee, such as a clipping-type hit in football, or non-contact twisting or deceleration injuries of the knee, frequently result in tears of the ACL. Typically, the injury is associated with a painful pop and significant swelling thereafter. After the initial pain and swelling subside, patients report a sense of instability or giving way episodes affecting their knees with sporting activities. Because the ACL has very limited healing potential, surgery is recommended to treat athletes who sustain ACL tears. For further information about any of these injuries or other orthopedic issues, please feel free to contact my office at 480-219-3342 or visit my website at phoenixshoulderandknee.com.